Good morning, everyone. Thank you for attending the very first of our in-services of 2023. I'm going to turn over the controls here in a second to Oliver, and he's going to talk about vaccines and seniors. If possible, please remember to mute yourself and either save your questions till the end if you're on the phone, or feel free to use chat and ask them as they pop up. Don't wait till the very end. And I'm going to turn it over to Oliver.
Hello, good morning, everyone. I'm Oliver Valdez. I'm a pharmacy student at Campbell, and I will be presenting about vaccines for seniors. The picture that you see right now, it's a picture that I saw before COVID vaccines came out. So just thought it was interesting, just to think like how crazy things can get if there's not any vaccines available. So let's just move on to, oh, sorry. So moving on to the presentation outline, I'm going to talk about vaccine recommendations for all adults age 65 and older, and then also for those that have comorbidities. I'm going to talk about the vaccine preventable diseases, and then review some vaccines like the flu shot, pneumococcal vaccine, shingles, and Tdap vaccines. So the Centers for Disease Control and Prevention, the CDC, recommends the following vaccines for adults that are age 65 years or older. These are the influenza vaccine, the pneumococcal vaccine, the Tdap or TD or Tdap, which is the tetanus, diphtheria, and pertussis vaccine, the zoster shingles vaccine, and hepatitis B vaccines for those that are at increased risks. In addition to the vaccines recommended by the CDC for adults age 65 and older, several other vaccines may be recommended depending on individuals' health status or other factors. And these include like the MMR vaccine, the chickenpox, meningococcal vaccine, the HPV vaccine, and hepatitis A vaccine. At any point in the presentation, if there's anything that you would like me to explain a little bit more, feel free to just interrupt me. There's a lot of information and I'm not gonna like cover everything, but it's right there in the handout for your information. But it is always important when you're thinking of getting a vaccine to consult your healthcare provider to determine which one is the best vaccination schedule for you, depending on your comorbidities and your health status and previous vaccines that you've had. So as far as some additional vaccines that are recommended if you have certain comorbidities, this is for medical conditions, or for underlying medical conditions or people who are immunocompromised. They may require additional vaccinations or different vaccination schedules compared to people that don't. Certain of these underlying medical conditions are chronic lung disease, heart disease, diabetes, and chronic kidney disease. And they recommend these next vaccines. So the influenza vaccine that is recommended for all people, all seniors, pneumococcal vaccine, the Tdap or TD boosters, the shingles, and the hepatitis B vaccine. So this is similar to those that do not have comorbidities, but additionally, there's the MMR vaccines for adults that were born after 1956 who do not have evidence of immunity. So moving on to vaccine preventable diseases, vaccines are an effective way to prevent many serious and potential deadly diseases. And I'm going to cover some of them. Some I'm just going to like brush really fast, but there are some that I'm going to focus more on, which are the disease states on which vaccines I'm going to cover thoroughly. So there's measles, which is a highly contagious viral illness that can cause several respiratory infection and also brain inflammation and potentially death as well. There's mumps, which is also a viral illness. It causes fever, headache, and swollen glands. It can also cause inflammation of the brain or meningitis and deafness. And then there's rubella, which is also a viral illness, also known as the German measles, and it primarily affects the skin, eyes, and your lymph nodes. So all these three, you can get protected from all these three from receiving the MMR vaccine. And then there's chickenpox, which is a highly contagious viral illness that causes an itchy rash and blisters. It is very contagious as well, and it can be serious in people that have a weak immune system. And then there's shingles, a viral infection that is caused by the same virus as the chickenpox. It causes a painful rash and it can lead to long-term nerve pain and other complications, particularly in older adults. And although you see here that shingles is shown, like on the side of the stomach, it can actually present in multiple parts of the body, including like the face and the eyes. So there could be like complications with that. And there's a tetanus, which is a bacterial infection that affects the nervous system, and it causes stiffness and muscle spasms, and it can be fatal. This is usually contracted by either dirty wounds or burns. So like stepping on a dirty rusty nail, that could be one way of getting this bacteria. But also just, like a lot of people that have diabetes, they use like lancets and needles to like give themselves medications or to prick their fingers. And if those are not disposed correctly, you can get a accidental needle stick, and that can also potentially lead to tetanus. There's diphtheria, which is a serious bacterial infection that affects the nose and throat. It can cause difficulty breathing, heart failure, and paralysis, and this one can be fatal. There's also pertussis, which is also called whooping cough, which is a highly contagious bacterial infection that is going to affect your respiratory system, and it can cause severe coughing, difficulty breathing, and it can also be fatal. Whooping cough can last even weeks to months, and it's very, very bothersome and again, very contagious, specifically to young children. And then there's polio, which is a viral illness that can cause paralysis and death, which we've...
Now, a little audio would be nice.
Can you all hear me well?
I can hear you just fine.
Okay, I'll just keep going. And then there's the influenza, which is a viral illness that can cause fever, cough, sore throat, and body aches. One of the most common that a lot of people are familiarized with, but it can also be fatal. It can lead to serious complications like pneumonia, especially for older adults or people that are at increased risk, those people that have a weakened immune system or underlying medical conditions. And then there's hepatitis A, a viral infection that affects the liver. It can cause severe liver damage and jaundice. And then there's also hepatitis B, a viral infection that affects the liver and can cause chronic liver disease and cirrhosis, and potentially can lead to liver cancer in the long run. And then there's pneumonia, which is a lung infection that can be caused by different types of bacteria or viruses. It can cause severe respiratory illness. It can also be fatal, particularly in older adults and people with underlying medical conditions. And this can also be a complication of either influenza or any other respiratory illnesses. And then there's the human papillomavirus, or HPV. It is a viral infection that can cause cervical cancer and other types of cancers if it's not like addressed early on. Typically, people get the vaccines when they're like younger, in the 20s or teens. And then this list is not exhaustive. There's other vaccine preventable diseases that I am not covering this since they're not too prevalent in the United States. So I'm gonna cover in like a review about the flu shot. So what is a flu shot for? It is a vaccine that helps protect against the influenza, and which is commonly known as the flu. The flu is highly contagious, and it can cause fever, cough, sore throat, body aches, and other symptoms. It can lead to complications like pneumonia, which are pretty serious, especially in older adults and young children, pregnant women, and people with certain underlying medical conditions. So I want to stop right here and then ask you truth or myth if someone wants to participate from the audience. And so if I get the flu shot, I should not get sick. If I get sick, that means that the vaccine doesn't work. Is this truth or is this a myth? Someone from the audience that would like to just take a shot at it? 50-50.
Myth.
You say myth? Yeah, so this is a myth. So you can still get the flu even after you get the flu shot, but it will protect you from severe complications and even death. So it's not going to guarantee that you will not get the flu shot, but it's going to make it less likely for you to end up in the hospital or end up with a complication like pneumonia or some other like viral illness, or even like a heart attack, because some people can get heart attacks also from the flu. So it's going to lead you to prevent all those worst things from the flu shot, but you still can get the flu. So it is worth it in that sense. So how's it made? There's two ways of making the flu vaccine. There's inactivated or killed inactivated flu vaccines, which is a killed virus that's inside the flu shot that you're receiving. And then there's also one that is live attenuated flu vaccines. So the inactivated vaccines are those that are made with a killed influenza virus. These vaccines cannot cause the flu because the virus is dead, and they are given as an injection into the muscle and are the most common type of vaccines in the United States. So the live vaccines, these are vaccines that are made with a weakened influenza virus. These vaccines cannot cause the flu, but they can cause mild flu-like symptoms. They are given as nasal spray and are not recommended for certain groups of people that have more propensity to have complications from these vaccines, like pregnant women and people with that are immunocompromised, and are not recommended for seniors. And FluMist is one of the vaccines that is, or the only one that is available as a live vaccine. All of the other ones are inactivated. So here comes to another truth or myth question. So I don't take the flu shots because when I do, I get the flu. Is this truth or myth? Anyone from the audience?
Myth.
Yeah, absolutely. So it is a myth. So flu vaccines that are recommended, specifically the ones that are recommended for seniors, they are inactivated vaccines. So they have a dead virus in them. And this virus cannot activate in your body and cause the disease. But it can potentially cause you some side effects from the vaccine, just because you're introducing something to your body that is starting your immune system. So things like flu-like symptoms, like a little bit of body aches and chills, some injection site pain, that can happen, and it's common. But that is just a normal immune response. It's not you getting the flu. So there's different types of flu vaccines. There's trivalent and quadrivalent vaccines. This refers to the number of components or strains of the virus that the vaccine has. So the flu is caused by two different types of viruses, influenza A and influenza B. And then there's different strains within each category. So within influenza A, there's different strains. Within influenza B, there's different strains. So the healthcare organizations like the World Health Organization or the WHO and the CDC, they do a lot of research in this in order to sort of like predict what are the strains that are going to be most harmful for the following year. And they tell manufacturing companies that these are the strains that we care the most about, and those are the ones that get put into the vaccines. In the 2022-2023 season that we're in right now, 100% of the vaccines are quadrivalent vaccines. So there's no vaccines that are trivalent. And this became the standard because quadrivalent vaccines gives us better protection against the flu. So it has 2 strains of influenza A and then 2 strains of influenza B. So why is this good for seniors? Seniors are at a higher risk of serious flu and flu-related complications. This is a few of some of the statistics. So pneumococcal pneumonia kills more than 18,000 older adults in the United States each year. And getting the flu puts you at a higher risk of contracting pneumonia. Also, getting the flu or increases your risk of heart attack 3 to 5 times. within the first 2 weeks of infection, and increases your risk of stroke 2 to 3 times in the first 2 weeks of infection. Yeah, so, and then there's high rates of related deaths and hospitalizations in adults 65 and over. 78% of those are flu-related hospitalizations, which is a huge number to think about. So when should you get the flu vaccine? Everybody should get the flu vaccine annually. 1 dose of a vaccine that is appropriate for your age and health status. So one of the things to think about is if you have any allergies. So for example, vaccines are made with egg components. So if you have an egg allergy, you might need to take a different vaccine. So for example, if your egg allergy is only a rash, any vaccine would be fine for you. But if you want to be extra careful, you can always use those vaccines that are egg-free and ask for those at the pharmacy or your doctor's office. And then there's those that, and then if you have a severe egg allergy to the point where it's more than a rash, you can't breathe, or your face swells, then you absolutely need to get an egg-free vaccine. And the ones that are available in the market that are egg-free are Flucelvax quadrivalent and Flublok quadrivalent. Flublok right here is one that is recommended for seniors over 65, and then Flucelvax is a regular strength vaccine. And then, of course, there's some contraindications for, or some people should not use certain vaccines that are live vaccines, and this includes people 50 years or older. So which vaccine should you get? So for seniors age 65 and older, it is recommended to get the high dose and or adjuvanted flu shot. So what does high dose mean? The immune system response decline as adults age. So certain vaccines are available to help boost your immune system. A high dose vaccine contains 4 times the amount of like antigens, which is the dead virus, the dead flu virus, versus regular strength vaccines. So more antigens means that your immune system response is going to be greater and give you more protection. Now there's also adjuvanted vaccines, and an adjuvant is an ingredient that is added to the vaccine to help it become stronger. A stronger vaccine produces a stronger immune system, which is beneficial to develop a defense against the flu virus. These are beneficials for people that are older than 65 and people that have a weaker immune system. And does the brand matter? No. So the CDC does not recommend one brand over the other. There are 3 vaccines that are available in the market. This is the Fluzone high dose quadrivalent. So this is a high dose vaccine, contains more antigen. There's the Fluad quadrivalent. This one has the same amount as the same amount of virus or dead virus as the regular strengths, but it has the adjuvant that makes it a little bit stronger, or much stronger. And then there's the Flublok high dose quadrivalent. That one also is an adjuvated vaccine that has the same antigen as a regular strength, but it's made stronger. In this one of the neat things about it is that it's egg-free for those people that do have severe egg allergies. So moving on to another truth or myth. So if the high dose flu vaccine is not available at the pharmacy, then can I get the regular strength shot? True or myth?
True.
Yep, absolutely, truth. So the CDC says that any strength flu shot is better than no flu shot. So if you go to the pharmacy and for whatever reason they say that, you know, like the high dose vaccines are not going to be available in 2 to 3 weeks, and let's say, you know, like you're in October, November, going into the flu season, you don't want to like stay not protected, so you can go ahead and get the regular flu shot. But once you get the regular flu shot, then that's the one that you're going to have, you know, like for the rest of the year. Don't go back to the pharmacy and get the high dose. So only one flu shot a year. So one of the things that is important to mention is that is this covered by Medicare? So yes, so flu shot are covered under your Medicare Plan B, which is also known as your medical insurance, or your red, white, and blue card that looks like that. So make sure to take this card whenever you go get your vaccine. So moving on to the pneumococcal vaccine. So first of all, what is this for? So it is a vaccine that helps protect against Streptococcus pneumonia, which is also known as pneumococcus, which is a type of bacteria that can cause a wide range of illnesses, including pneumonia, meningitis, and sepsis. So pneumonia is an infection of the lungs that can cause severe respiratory illness and can potentially be fatal. And then meningitis is an infection of the protective covering of the brain and spinal cord that causes inflammation of the brain. And then sepsis is a severe bloodstream infection. So truth or myth? You can catch pneumonia anywhere and at any time of the year, not just in the winter months. Is this true or is this a myth? If anybody wants to try.
True.
Yeah, absolutely. So people typically associate pneumonia with cold and rainy weather, especially with the winter months, but you can catch it at any time of the year. So it is important to be protected at all times. How's a pneumococcal vaccine made? There's several vaccines. I'm not going to go into too much into detail into how the vaccine is made, but more so just highlight the differences between the vaccines. So there's the pneumococcal conjugate vaccine, or PCV, that is made of using 13 strains of the pneumonia bacteria. There's one that it's a polysaccharide vaccine that is made. It's a like inactivated bacteria that is purified, and it's made out of 23 different strains of this bacteria. So both types of the pneumococcal vaccines are effective in preventing pneumococcal infections, but they work differently. So the PCV13, which is a conjugate vaccine, is designed to help the immune system create a stronger and longer lasting response, while the PPSV23 is designed to help the immune system produce antibodies to protect against specific types of pneumococcus bacteria. And then there's also some new vaccines, the PCV15 and the PCV20. So these are similar to the PCV13 in the way that they're made, but they have a different number of types of this bacteria that are put into the vaccine. So the 13 has 13 strains, the 15 has 15 strains, and the 20 have 20 strains. So truth or myth, getting the pneumococcal vaccine can cause you to get pneumonia.
Nope.
That's correct, it's a myth. So the pneumonia vaccine does not contain live bacteria. So these are killed bacteria, and it's just components of the bacteria that are gonna help you create the immunity, but the vaccines cannot cause the disease itself. So how good are these vaccines? So the Pneumovax 23, the one that has 23 strains, prevents disease by 60 to 70%. The PCV13 prevents disease by 45% and severe disease by 75%. The Prevnar 20, one of the new ones, or PCV20, has 7 additional strains of the pneumococcus bacteria compared to the PCV13. And it accounts, so those 7 additional strains account for roughly 40% of all US pneumococcal disease cases and deaths. So that is what the additional protection of the 20 entails. And then the PCV15 has 2 additional strains of the pneumococcus bacteria compared to the PCV13 that account to roughly 50% of invasive pneumococcal diseases. So it helps increase, so from the 15 to the 13, the comparison is that when it comes to severe disease, it helps you, it gives you more protection for that, which is great. So when should seniors get the vaccine? If you've never received a pneumonia vaccine and you are 65 years or older, it is recommended to receive the Vaxneuvance, or which is also called the PCV15, followed by the Pneumovax 23 1 year later, or just the PCV20 by itself. So you can there's two different ways to get vaccinated, either get two vaccines, the 15 and then the 23 1 year later, or just to get the 20 alone, and you're done. You may also receive a vaccine if you're between the ages of 19 to 64 years old, if you have any underlying conditions or any of these things are present, like alcoholism, if you have a spinal fluid leak, chronic heart, liver, or lung disease, chronic renal disease, and immunocompromised conditions, like, for example, diabetes and other conditions that would weaken your immune system. And if you've received the Prevnar 23 vaccine in the past, it is recommended to receive one dose of either the PCV 15 or the PCV 20 after. So those are kind of like the three different pathways. And then one of the most important things is it's covered by Medicare. It is covered by Medicare Part B, which is your medical insurance, and it is also covered by Medicare Advantage plans within in-network providers. So again, this card right here, your red, white, and blue card, will be the one to take to the pharmacy whenever you want to get this vaccine, or to the pharmacy or to your provider. So moving on to the shingles vaccine. So what is it for? It is a vaccine that helps protect against the herpes zoster virus, which is commonly known as the shingles. It is a viral infection that is caused by the same virus that causes chickenpox. And after a person has had chickenpox, the virus can remain in your body, and it kind of like goes to sleep, but it can later in life reactivate, causing the shingles. And again, like the shingles is typically a painful rash and blisters that can lead to long-term nerve pain and other complications, most commonly in older adults, but also in people that are immunocompromised. So, truth or myth? You can get shingles after highly stressful life events, especially if the stress is daily. Is this true or is this a myth?
That is true.
Yep, absolutely. So high levels of stress can actually weaken your immune system. So psychological stress can cause this, but also stress that is due to something that's more like physiological, so like illnesses, malnutrition, injuries. For example, there's been cases where like there's car crashes happening and people can get shingles after that due to the amount of stress and that the body takes from a type of injury like that. So how is the shingles vaccine made? It is made using a live attenuated virus. This means that the virus has been weakened, so it cannot cause the disease, but it's still able to stimulate the immune system to produce a protective response. And the virus that is put into these vaccines is the varicella zoster virus, which is the same one that causes chickenpox. The virus is usually grown in a laboratory using chicken embryos and then purified and processed in order to create the vaccine. So how good is this vaccine? So the CDC reports that 99% of Americans over the age of 40 years old have had chickenpox. So if you're older than 40, it's pretty likely that you've had it before. People who have had chickenpox are at risk of developing shingles. And this is because the virus is still asleep in your body. So truth or myth? The rash is the biggest problem when people develop shingles.
It's the pain.
Yeah, it's definitely the pain, and the pain can come from like different complications, also from the rash. So the nerve pain from the rash itself is excruciating. People usually, it's like probably like something that you've never experienced before in your life. But but it may not end there. Your skin is also very prone to infection by bacteria that naturally live in your skin. And that can cause further complications. Also, in 10 to 20% of the cases, shingles can happen in the eye or around the area of the face. And if it does, there's also a potential to cause blindness. So there's those risks as well. So the only vaccine that is available for seniors is called the Shingrix vaccine, and it is a 2-dose series. This vaccine is good as it can decrease your chance of developing shingles by 91% for adults that have a healthy immune system, and about 70 to 90% if you have a weakened immune system. So when should seniors get it? So this vaccine is recommended for people that are age 50 years or older, but for immunocompromised individuals, it may be recommended much sooner, so at the age of 19 or older. And there is no maximum age for getting the shingles vaccine. So even if you are, say 70, and you've already, you've been those 20 years without the vaccine since it was recommended, then you can still get it and prevent those that nasty rash from coming out. So it is recommended to receive the 2-dose series of the Shingrix vaccine even after receiving the Zostavax vaccine. So the Zostavax is the old shingles vaccine that it was not as effective as the one that we have today. The Zostavax would give you like a 50% coverage from developing the shingles, and the shingles is much more effective for preventing shingles. So even if you had Zostavax in the past, it is important to get the Shingrix vaccine. And is this vaccine covered by Medicare? So your red, white, and blue card will not cover the shingles vaccine. This vaccine is covered under Medicare Part D insurance, which is also known as your prescription insurance. So it will be a card that looks kind of like this if you have that specific private payer, like Blue Cross Blue Shield. But not all Medicare Part D plans cover the shingles vaccines in full. So that is something to take in consideration. So, but you can contact your insurance company or ask your pharmacist whether the vaccine is covered by your insurance. They can help you with that. So truth or myth? I can't get the shingles anymore because I had it once already. Is this true or is this a myth? Well, I'll just go ahead and answer. So it's a myth. So you can get the shingles twice, and although very rarely, you can also get it a third time. So it is important that even if you've had the shingles before, you've had that experience, you can still get the vaccine and prevent it from happening again. And then last, I'm going to cover the Tdap shot and Tdap boosters. So what is it for? The Tdap vaccine is a combination vaccine that provides protection against 3 bacterial infections that I covered earlier. So the tetanus, diphtheria, and pertussis, also known as the whooping cough. So Tdap stands for, the T is the tetanus, the D for diphtheria, and then the AP part is for pertussis. So the tetanus is a serious and life-threatening bacterial infection that affects the nervous system, and it causes that muscle stiffness and spasms. Diphtheria is a bacterial infection that affects the nose and throat and causes difficulty breathing, can cause heart failure and even death. And pertussis is highly contagious respiratory infection that can cause severe coughing and difficulty breathing. And it can be particularly dangerous for infants and young children. And it's highly contagious. So getting vaccinated with Tdap is an important way to protect yourself and others from these serious bacterial infections, but particularly those in close contact with you, like infants and young children. So truth or myth? Tdap vaccines are only for kids.
No.
Yeah, absolutely not myth. So typically when you're a kid, you get the DTaP vaccine. Yes, to cover for these illnesses, but not everybody gets them as a kid. People usually, or some people don't get it as a kid. Some people that come from other countries might not get it as a kid. So you can still get it as an adult, and is recommended as an adult to get it every 10 years because the protection for the vaccine diminishes over time. And then also, even though like it affects more, the whooping cough affects children the most, seniors can still get it and can be very bothersome. It can cause severe respiratory illnesses. And then also accidents like dirty wounds or burns can happen to anyone, regardless if you're a kid or older adult, you just can't control it. So the Tdap vaccine, like most of the vaccines that I've been talking about in this presentation, is made using an inactivated or a dead form of the bacteria that causes the tetanus, diphtheria, and pertussis. So once the bacteria is killed or detoxified, they are then combined with other ingredients, such as adjuvants, which is like the substance that enhances the immune response for the vaccine, and some preservatives to create the final vaccine. So it does not contain live bacteria, so it cannot cause a disease that is intended to protect against. So how good is this vaccine? So full vaccination will decrease your risk of developing the complications that are caused by tetanus bacteria by 100%, and 97% for diphtheria toxin. This means that it gives you almost 100% certainty that you will not suffer from these conditions. So truth or myth, the immunity of the vaccine does not last forever. I think I already like alluded to this.
That's true.
Truth.
Yeah, absolutely. So it's truth. So the immunity actually wears off over time. The full effectiveness of the vaccine lasts about 10 years. So again, it is recommended to get a booster every 10 years. So when should seniors get it? If there's no history of primary vaccination against these three bacteria, then the 3-dose series is recommended. So starting with month 0, so you get one dose, and then a month after you get a second dose, and then you get a third dose 6 to 12 months after the second one. You can get the Tdap or the Td for these 3-dose series, but it's recommended to get the Tdap as the first dose. The Tdap contains the pertussis, protection against pertussis, and then the Td only contains protection against the diphtheria and the tetanus. So if you did not receive the Tdap at or after the age of 11, it is recommended to get 1 dose of the Tdap. Oh, yeah, that's basically, yeah. So yeah, and it is also recommended to get the Tdap booster every 10 years because the vaccine immunity is going to decrease, or your protection against these diseases is going to decrease. But if you had an accident where you have a severe wound or a dirty wound or burn, it is recommended to get a booster within 5 years of your last dose. So is this vaccine covered by Medicare? So it is usually covered by Medicare prescription drug plan. So this is the Part D insurance, and it is not covered by your red, white, and blue card. So again, it'll be like a card that looks like this, not the other one. And lastly, where can you get these vaccines? So the vaccines are widely available. Some are more than others. For example, it could be a little hard sometimes to find a Tdap or TD booster at certain pharmacies, but the flu shot is widely available in many places. But you can obtain all these vaccines from doctors' offices. Many primary care physicians and specialists may offer for their patients in clinics as well. Pharmacies are a good way to get these vaccines, as there's a lot of pharmacies and they're very accessible. Right now, because of COVID, they're doing a lot of vaccines by appointment. So you might have to go online and do some appointment of some sort. Also through employers and schools and some health fairs, people can obtain these vaccines. And these are my references, and I'll be happy to answer any questions.
Does anyone have any questions for him? It was very thorough. Excellent topic, Oliver.
Thank you. I know it was a lot of information.
It was, and it might be that I end up getting questions later because it was very thorough, and that's perfect. But if I hear no questions for him, I'm going to take him off the hotspot.
Thank you. Have a good morning.